I'll call this special regional council meeting to order. Please be advised that today's meeting is available for the public to attend virtually and is being streamed and recorded. Can I get a motion, please, to adopt the agenda? Moved by Councillor Penny, seconded by Councillor Andrews. All those in favor? Carried. Delegations, Dr. Mostert, it is good to see you.
Thank you. Good to see you.
You'll be doing a presentation to us today on local health services, an update? No? Okay.
He was invited at council's request,
Oh,
so he's not prepared because he's here as a guest.
very well.
Didn't ask for
Huh.
You're just for if you need to, when you speak, you just push the speak button on the mic and it'll cue and you're good to go.
Well, Dr. Mostert, we were interested in the state of healthcare in the Northern Rockies, so I guess maybe I'll start off asking you if you have any concerns about Northern health service levels or anything the municipality can do to provide better healthcare to our citizens.
Well, I've got quite a few concerns in regards to Northern Health and how they providing healthcare in Fort Nelson. It seems to me that we don't really get the full service here locally. And there's a few things that you can look at. You can look at the laboratory services at the moment that is basically stopped here in Fort Nelson, that they are only taking blood and they sending it away, or they taking laboratory specimens and they send it away to Fort St. John to be processed there. We do not have lab techs available anymore in Fort Nelson. And that has got huge implications for emergency services. They have now started with what they call point of care testing, which means that it is smaller units that can give you some results, but we do not have the ability to do a hemoglobin. So we can't see whether the patient is anemic. We can't see in a trauma what is the patient's hemoglobin. We haven't got a way to measure white blood cell count, which is a thing that tells us how's the infection or how bad is the infection. And all of these things are now being sent to Fort St. John with a turnaround time of a day or two. So especially in emergency services, that is not adequate. It offloads a lot of work onto the nurses, because the nurses now need to draw the blood in an emergency. They need to process the sample in these point of care units. And already our nursing staff before was stretched to a limit. So that causes then extra stressors in the whole system. Apparently, they do not have lab tech or lab personnel on call anymore after hours to do blood collection. So that now defaults basically to the nurses to do it in an emergency. We had very little knowledge of this happening, and I don't think that Northern Health had that much of a lead time towards it. We had one meeting with Northern Health where at that stage they informed us that in an emergency we can send blood off on a emergency base with a plane to Fort St. John. Whether that actually is going to work and whether that is going to materialize, I don't know, but we were not informed that there is no lab personnel on call. So even if we send it off, the nurses got to draw it and then send it away and then process it. The same thing has happened to some degree with the sterilizer in the hospital. is that we were just informed as a by the way that in August, they're not going to renew the maintenance contract on the sterilizer. And as such, all our sterilizing equipment is going to be sent down to Fort St. John to be sterilized. And that is going to happen twice a week, that they're going to send the sterilizing down to Fort St. John. That hasn't happened yet because we're now waiting for the machine to break, because if the machine breaks, then they're going to implement this secondary system of doing everything in Fort St. John. So standing on the sidelines, it looks to me like they basically trying to centralize everything in Fort St. John, which I don't think is a very good plan in this region to get all our health service delivered from Fort St. John.
So let me stop you there for a second and just ask a few questions here surrounding the lab technicians. So I believe a full complement of lab technicians is 3 at our hospital. Is that correct?
Say again?
Is a full complement of lab technicians 3
I believe so.
at our hospital? So now we have, do we have any lab technicians at our hospital at all?
No.
No, none, 0. And is there any plans to replace those lab technicians?
They said that they are planning to replace it, but lab techs is few and far between. And we do not know how aggressively they're looking for lab techs.
Okay.
They haven't implemented anything to try and move lab techs from other areas to Fort Nelson. And I don't know if there was any plans to have like, I wouldn't say locum lab techs, but the same as with X-ray techs that they sometimes can get out of a pool, that they can get people to come up here. Initially, when they told us about the lab, they said that they had to decommission the machines if they didn't have a lab tech here locally, which means that the machines would not be functioning. And I'm not sure if they were planning to actually remove the machines and put it somewhere else, or whether they were just planning to take the reagents and take it somewhere else. But the thing is that it looks to me that frequently they know about things that's coming down the pipeline, and we're not really fully informed, both as a council and as medical personnel, about what is going down and what is coming down the pipeline. And we are just being informed as an afterthought that this is coming down. We do have the health council meeting where we are supposed to discuss a lot of these things, but frequently it seems to me that these things do not come up in those meetings.
As far as the sterilization of equipment, this is an autoclave, I guess. Is that the hospital? Is that it, or is it a
Sterile autoclave that is there.
Yeah. The equipment that's being sent out. Is there a complement of equipment that is staying in the hospital that's already sterilized? And then what's happening is there's a.
So what initially, when we heard about this, I informed them that they need to look at what is the minimum amount of equipment that they've got it. And they've got to look at it and they got to increase those amounts so that that can then factor in for the time lapse that is going to be to go out. As far as I know, they haven't really increased any of the amounts that we have at the moment in the hospital. I know from before that they actually have taken a lot of our surgical equipment that was in Fort Nelson. They've taken it away and distributed to other areas. And partly it is because our operating room is not really working at the moment. So they would take the C-section kits. I think we had 3 at one stage, and I think we got left with 1 year at the moment. But they looked at all our equipment and basically scavenged everything for other hospitals. And when we heard that the sterilizer is going to go down, we informed that they need to look at their minimum amounts that they need here in Fort Nelson. They actually need to increase it to be able to make sure that we got adequate levels of what we need here locally. So that would be things like suture kits and stuff like that that we were looking here locally.
But we haven't, but the autoclave is still working at the moment.
The autoclave is still working at the moment, but I believe that if anything goes wrong with it, they're not doing the maintenance or they haven't got the maintenance contract anymore.
Just going back to one thing you said about the C-section kits in the operating room. I mean, currently we don't have a surgeon here. Is it possible for us to, in an emergency, use that kit?
Yes, it is possible.
Okay. Are there any other questions for Dr. Mostert?
I would like to hear the rest of your concerns, please.
So the other thing that is basically dear to my mind is the CT scanner here locally. I think that we need a CT scanner. I think in this day and age that we can't work in a emergency services without having a CT scanner. And I think it is a necessary piece of equipment. We need it to be able to treat strokes. We need to able to, for cervical spine injuries, to basically clear those spines. We're using X-rays at the moment for the cervical spines, but it's not as accurate, it's not as good as what the CT scanner is. I've gone forth and I said that for a stroke patient, we need a CT scanner just because of our time to get to a place where we can get a CT scan. And if there is more than a 4-hour lapse from starting of symptoms till a CT scan is done, you can't use the treatment for it. And we've seen a few patients here locally that has had strokes that could not access treatment and as such had very bad stroke outcomes. And in this day and age where we do have some basically treatment options, we can't utilize those treatment options without a CT scanner. I had talked to a doctor from Haida Gwaii, and we are starting with a business plan to see if it makes a business plan for a CT scanner. Personally, I think that you don't need a business plan to look and see whether you need a CT scanner. I think you need a CT scanner because you need a CT scanner. But we are doing this business plan, but again, it is being offloaded on people outside of Northern Health to do the business plan. So I'm using staff at the clinic to look into it and to do the numbers. Some of those staff are being paid through Doctors of BC, which is, I wouldn't say that is our union, but that is our support for the Doctors of BC, but it is not Northern Health that is doing it. And I don't have the feeling that Northern Health think that this is a big issue and it is not something that they're pushing. I believe that the town does have the budget for the next 3 and 5 years, and I don't think that there's a CT scanner on that 3 and 5 year plan.
No. And this, I mean, officially, this is the first time the CT scanner has been brought up to council as a whole here. And I understand there's some fundraising that is currently going on for the CT scanner. Is that correct?
So as we had these initial meetings, and Northern Health was part of those initial meetings, and they think, yes, it looks good, we need to go through this business plan. My feeling is that if we can raise the amount for the CT scanner and bring it here, then that can twist Northern Health's arm to be able to get the CT scanner here. And I know in some other places, like in Grand Prairie, that the foundation there raised money to get the MRI. They got the MRI, and then that forced the provincial government then to get the MRI and to get the support for it there. So Northern Health is saying that they are serious, that they want to get this, but I don't see that they really doing things to make it happen. And personally, I think that we need to look and see if we can get the scanner here, that at least then that is going to force them. So I've gone ahead through Rotary to try and start getting donations and getting the Rotary auction to basically get money for it. And I'm personally going to also, whatever they make in those, what Rotary is going to donate, I'm also going to donate it personally as well.
And how much is, what's the cost of the
The
CT?
scanner is in the range of about 250,000. So when Northern Health were looking at it, they were saying it is going to cost about 750,000 to do the room upgrades to be able to take a CT scanner, because where the X-ray department is at the moment, there's a lot of asbestos in the wall. And apparently to do these upgrades is going to cost 750,000. I'm not sure how accurate is those numbers. Personally, I feel if we can have a separate new building on the hospital property, that we can put the CT scanner there, I think it's going to be cheaper erecting a new small building than to try and refurbish old. But that is my personal idea.
Okay. Any questions for Dr. Mostert so far from council? Councillor Penny.
What would you like to see us do to help you with these issues? What would you like to see council do? Is there something in particular?
It's difficult, I think, for the council because they have tried to push Northern Health to do things, but Northern Health is very difficult to get moved into directions that we want them to move to. When we had the health board here locally, before they had the regionalization, I think we had much more say over recruitment and retention of people here locally. I think that we were able to bring people in and make sure that they stay here. So for the lab tech, I think that if we could do things to make it for them more better for them to come to Fort Nelson, that would help. I think that the council has already gone far and beyond what was expected with them with recruitment of doctors. I think that the housing that has been provided has done a lot to alleviate some of the stresses that we had, and I would like to thank the council for what they've done in that regard. Personally, I think it's not right that we offload all the responsibility of Northern Health onto local people or local council to do things that I personally feel that they should be doing. So I'm not sure there's anything specifically that council can do. It would be nice to have their support in these things. The other thing is just that with the health council advocacy, we haven't been at any contact with Blakey, that he hasn't contacted doctors. And if you're talking about local health issues, and we haven't really been involved with any of that. We have had one request for a meeting, but this was during normal working hours, so that was very difficult for any of the doctors to go and attend these meetings. A lot of the things that has been brought forth, I think, has got merit and has got a lot of benefit to what is being said there. I just haven't seen anything really realized from those things. And I think that this is more just at the moment the direction that they're looking in where to go to. And we haven't really figured out how to go from here to there.
So specifically to that, I did ask Mr. Blackie if he'd reached out to the doctors, and he said that he had, but so I think that is going to require a little follow-up on my end to find out why you haven't been contacted, or you've been contacted once during business hours. We need to do something a little better than that.
Yeah,
Councillor Penny.
specifically, I'd asked them as well for the documentation to back up, because he had said he made many attempts to reach out to the doctors, and I haven't heard anything back yet.
I personally have only talked to him once, and that was in a meeting that we had in regards to another meeting that he wasn't even supposed to have been at that meeting. And that is the only time when I've really seen him, and I've seen him at some of the health council meetings that we've had here. But
Okay,
other
thank
than
you.
that, I have had no personal contact.
Well, we can certainly follow up on that. Any other questions? Councillor Gerwin.
Thanks so much for coming today, Marius. I really appreciate it. I think everybody knows how I feel about Northern Health. There's no secret. I feel like, really? I feel like we're just playing whack-a-mole. You know, it's been what, 17 years now since they're 12, or how many years since the maternity issue first got us all rallied around that. And from there, it, you know, was the chemotherapy start, removal, and the list just goes on and on and on. The ultrasound, like waiting, I don't know, 4 years now for a report from Northern Health as to why that room, the accreditation of that room can't be changed. The service level for the ultrasound, now it's lab, or sterilizer, now it's the lab, like, and the CT scanner. I feel like, you know, we do everything that we can to try to solve some of these problems, and to my way of thinking, they're not getting solved in the best interest of our residents. We still have to go out for so many trips, right? For all kinds of services. And also it's not providing the physicians and the healthcare professionals a safe working environment, really. Like, I mean, I've seen you, I can't imagine, you know, you do what you do, knowing that, you know, a plane isn't gonna come, like there isn't, you're it, Matt, like you're it. So like, I'm all like, how do we get, I don't know how you feel, but I just want to get rid of Northern Health. And how do we do these services back to the local health board? Like I'm not simple, so don't think that I am, but the provincial government has created these regional health authorities, but we can fundraise for a CT scanner, or we can fundraise for an ultrasound machine, but that didn't, you know, increase our levels of service. We can recruit or add incentives to hire a lab tech, but then he or she works at the hospital. We have no control over that work environment, which some would say is not very nice up there right now. I don't know. So how do you have any ideas as to how we can get back some of that control, so that, you know, if we're adding incentives to hire somebody, that we have some control over what their work environment would be?
The thing is that I've been thinking sometimes that we should go and have a publicity campaign or whatever, try and, because that is the only way of getting things done, is sometimes to put people's feet to the fire and to make people aware that this is what's happening. Also, the community here locally must know that this is what's happening. The community must know that we've got limited capabilities now in emergency at the hospital for helping them. And so far, I haven't seen anything from Northern Health that they made the community aware that this is what's happening.
They did one Facebook communique. Yeah.
That needs you to go on Facebook and look at it. So
Right.
It just makes it very, very difficult sometimes to get them to move. And the only way sometimes to get them to move is to make it public and to make, because a lot of these people are in the public domain. And if there is a backlash from the public about it, that sometimes get them to move. And I'm not sure to go to the paper or to go to the TV or whatever is the way to go. I don't know. It just makes it very, very difficult if you see, and I don't think it is particular to us. If you look at Dawson Creek, they lost, I think, 9 to 12 doctors that they lost in Dawson Creek. And they went to a virtual doctor for the emergency. So that means if you go into the emergency for a time period there, you saw somebody on a screen and there wasn't a doctor there locally to help you. And
Dawson Creek,
that
yeah.
then meant that they had to draw nurses from their OR to come and work in the merge, and that meant that they had to close the OR because they didn't have OR nurses. I think at this stage that the maternity is closed in Dawson Creek, and we've got a problem here. They've got a much bigger area there. They are closer to Fort St. John, but still, if they're doing that in Dawson Creek, it's centralizing everything in Fort St. John. As I said, I don't think it is just a local problem here.
So,
Councillor Souls.
Well, I'm sorry. I just, I wanted to jump into this because this is where I think we're going to have to go. The writing is on the wall for the longest time. Either we start lobbying, like one of the things we could do as a council is start lobbying for some of the Northern Health Executive to be changed out. Because we've had the same Northern Health executives who have overseen the decline of the healthcare system in our regions. And they've been there right from the conception of it. And they are obviously not doing a good job, and we don't like what they're doing. So we as a community can say, it's completely within our purview to say that we don't think that your leading is effective. We would like to see you replaced and start lobbying the health ministry for replacement of those people. That's a shakeup that actually has effect too, because you're poking the leaders of Northern Health in the eye when you start doing that, but maybe they need to be poked in the eye. See, so I also think though that, and the fact that you brought Dawson Creek into that picture and realized that the whole Northern Health is suffering the same things, means that it's also potential that the whole system of health, regional health authorities governance is failing. And if it's failing, we can all sit here and say, oh, well, we need you to work with us to supply what you're supposed to supply based on what we think the health system or what it used to be. And now we're watching it in a declined form, still asking for what we think it used to be. I think that if we're, I think that the solution to that, like in my own business, the solution to that is that I have to start doing what I used to get other people to do if those other people are not available or will not provide the service. And so as much as we, it's not a municipality's job to fund healthcare or to run the healthcare or administrate the healthcare, but I find it offensive that we're kind of stuck in this scenario where we can put whatever we want, fundraise and bring equipment to the table and so on. And we bring it in, but we have no say over it once it's there. In fact, a lot of the stuff that got pillaged out of our operating room, from what I understand, was stuff that came through donation, through funding, local funding that was there to put those things together. So a question I had for Marius directly as a businessman yourself too, can you own a CT scanner and plug it into the system?
Apparently, it's difficult to get the diagnostic accreditation, which is the people overseeing
Right.
the X-ray and CT scanners, to give them a license to operate personally.
No, but
not
difficult.
impossible. It's
It's
just
not-
difficult.
Difficult.
We can do difficult things.
The thing is just that, so it is a possibility that you can get a private CT scanner like what they've got in Dawson Creek to get something here. But we're now talking about in the emergency department that we're looking at mostly where I think that we need it. We also need it for the 590 CT scans that's being done every year on Fort Nelson patients that they travel to Fort St. John. But in my eye, you need to do it for the emergency patient. So if I got a stroke patient, then I got to cart them down to the clinic to get a CT scan and then cart them back. Or a patient with a possible cervical spine and cart them down and back. It just doesn't make sense. Yeah.
Still closer than Fort St. John.
So does Northern Health control the parking? Parking lot as long as we're paying for the parking.
And plug it into a 120 outlet. Councillor Andrews, did you have a question?
I'm just curious about that number, that 590 people that get sent down. How many people get referred for a CT and just don't go because they don't have the means as well? Like I'm sure there's a miss too. Like that number is probably higher.
It's most probably higher because the numbers that we're looking at is the ones that actually was done. We don't look at the referrals. We don't look at the amount of people that was sent down, but we actually look at the amount that was done. And even in the doctor's mind, you sometimes think, well, it would be nice to have this, but is it really necessary? Is it going to change anything? So we're working in that system as well, where you got to put a question mark over whether this is really a relevant test, and the financial burden that you put on the patient, is that worth it for the answer that you're going to get?
Councillor Gerwing.
So I just wanted to follow back up on perhaps, trying to get more local control over our situation. And so would you entertain the notion of like a partnership with the municipality and the clinic over providing services that Northern Health has deemed that they don't want to provide here?
Well, I would entertain it, and I can look at it. I mean, the other thing that I was thinking is that they used to have a private lab here. It used to be
They did.
in Dr.
Yep.
Kenyon's old clinic.
Yeah,
But then the province made it so difficult
right.
for private labs to function with all the rules and regulations that eventually they put their hands up.
Mhm.
I personally had a sterilizer in the clinic, but then the College of Physicians and Surgeons put all these prerequisites that we've got to do now. So we don't do any sterilizing in the clinic anymore. We send it all up to the hospital. Because you got to have a biological indicator, you got to have these things that needs to be documented and showed and everything else. And the bureaucracy makes it so difficult for private initiative that it is a disincentive frequently for those things.
And I think that's a disincentive for the hospital to want to keep that autoclave there because they've got to meet all those regulations as well, probably. And now what they're doing is they're determining that from a financial point of view, it is more economical to send it out than it is to have a bunch of these smaller labs that have got these rules and regulations around them, I would think. Is that about right? Is that why they're not renewing that autoclave?
I think a lot of it is financial reasons why they do a lot of these things. If we do a look at the lab now, they got 2 full-time positions that they're not paying anymore. They're not paying overtime. So they're saving a lot of money, basically, with this, what they're doing at the moment.
Councillor Penny.
That was the point that you guys ended up into, the point that I was going to make anyway. When you mentioned earlier you're making a business case for this scanner, I just find it very offensive that Northern Health even needs to look at the financial burden of the healthcare. I mean, I realize that yes, it's a burden to taxpayers, but when it comes to us being so far away from where they're looking to centralize it, it doesn't come down to money. I mean, 590 people in our community actually went out for a CT scan. As Councillor Andrews said, I'd really like to know the number of how many people were referred out that didn't get the scan. How many people, have had strokes that, had horrible effects just because we didn't have the ability to it. And with the sterilizer and looking at, oh yeah, I'm sure it is way cheaper. In their mind, it's going to be way cheaper to get rid of the sterilizer because they're going to stop paying staff from working on it. They're not going to have to keep the upkeep, But I think it's going to come down to just like if we ran the numbers for how many people get airlifted out because certain services aren't available. It's not that it becomes cheaper. It becomes cheaper to Northern Health because it gets moved onto a different budget. I don't think it actually saves the bottom line. It doesn't save the taxpayer a dime, right? For all of BC, but whatever reason, it gets moved onto a different budget somewhere else. So it just, whenever anybody starts to talk about budgets and healthcare, that's not how it works, right? We all pay into one big pool and we're all supposed to have equitable access to it.
That's the trouble that I've got with the business plan, is that they want to look specifically on the emergency transfer out of CT scans, because that implies that we have to get a plane to fly them out. And I think that Northern Health is going to go to the ambulance services and say, hey, we're going to save you all this money. Now you got to give us this pot of money that we are saving you so that we can afford the CT scan yet, which I think it is ridiculous. The other thing that I had a huge problem with is that we are supposed to have equal access to healthcare. But yeah, the people in Fort Nelson is subsidizing it by traveling to Fort St. John.
And I think we've all around this table have talked long and loud about the cost of transportation of sending patients out of the Northern Rockies here. And of course, there's some things that we will never be able to do in Fort Nelson, some medical procedures that we can't do. But for those things like CAT scans and other things that could be done here, it makes sense that Northern Health would find some mechanism, like for instance, maternity services, that they should at least help with the transportation costs of this. Councillor Souls.
Just a kind of a follow-up question to the idea of poking the Northern Health and saying, look, your leadership has not been effective. I'm wondering your perspective on whether how large of a factor in the ineffectiveness of a health group to make decisions and to provide, how much is the licensing issues behind the scenes, like you mentioned, the College of Physicians and Surgeons and the restrictive licensing requirements, or the difficulty to be able to get certified to do that CT work and interpret it. Like, is it more the fact that the regulations or the regulating bodies, do you think they are holding back the Northern Health of the world? Are they one of the causes of?
No, I personally think that it is more Northern Health.
More Northern Health.
It is more a paternalistic type of a structure that they've got. And it is, I think it's a top down, they tell everybody, and I think it starts in Prince George and then it goes to Fort St. John. I think that Fort St. John might have the same issues that we have got with Prince George, maybe not to the same extent. But I think it is the whole system is built like that.
Yeah, that's true.
And is that Northern Health or is that the Ministry of Health? I mean, how many of these orders are being sent from the Minister of Health to Northern Health saying this is the way you're going to conduct business? Or do we know that?
It's difficult to know that standing on the outside, because then you got to look at different other health regions and how they operate. But I think that Northern Health in particular is very much like this top-down structure that they've got, and centralizing and everything else. And part of it, I think, is because of our distances, that they feel that they've got to centralize instead of providing smaller units all over the place. But I think it is better to strengthen the local system so that we can able to be more self-sufficient here locally than to put all our eggs into Fort St. John's basket.
Councillor Goodwin.
I think the business case that Northern Health is requiring you to create to purchase the CT scanner to be of service to our community is, it just shows how they operate. It's another delaying tactic. Because how long is this going to take? How many resources does this take? And it's not Northern Health resources, it's Marius's resources or the community's resource. And then they're going to say, well, now you have to come up with $750,000 because we need to renovate this building. And that will be another delay and delay and delay and delay until Marius retires. Like that's, that's what they do.
Have they asked anything? Have they asked of you the $750 to renovate the hospital? Have they said, that's fine. You get us a CAT scan machine, but you're going to have to raise money to renovate
They
the hospital.
haven't told me to raise the money or any.
They haven't told you anything. They're at the business case stage.
They still, as you know, that it's not even on the budget proposals.
Right. Councillor Andrews.
And my concern with this process would be like with our ultrasound, they probably only going to give us a staffing of 0.3. And how are you going to fill the staffing? Sure, we get a CT scanner, but they won't work with us to get the employment there. What's the point? It's kind of, yeah, there's a big issue with Northern Health. And I agree. I think shaking up the tree, we should give it a try. Dude, we got to try something.
Councillor Penny.
I'm not sure this is included in our SIP this week or not, but letter actually that Councillor Gerwing sent me the other day from Premier Horgan. I don't know if anybody noticed that about the medical situation he's in currently. Just to read the first paragraph, basically, after noticing a lump in my neck, I went to the doctor to get a number of tests over the past few weeks. Those tests have revealed a growth in my throat that requires surgery tomorrow. Can you imagine if we could live in that world?
We don't want to live there, but we.
That's what I mean. But just, I mean, the reality of that. I mean, and so they have no idea. They have no idea in Victoria what we're going through. I mean, I think I wrote back to Councillor Gruen when she sent me this. It's too bad he couldn't have been here, and you know, maybe after a few months poking and prodding, maybe get sent out for some tests, which takes months to line up and back and forth, and maybe 2 years from now he finds out that, well, you know what, if we could have figured this out 2 years ago, you'd probably be okay. But instead, this is the reality he's living compared to the reality we're living. So, I mean, whatever we can do, Dr. Mostert, to help and back you guys up. I mean, we need to get up on that soapbox, and we need to be loud.
Councillor Gerwing.
I'm not sure if council's aware that there was an X-ray tech here
Mhm.
that has gone out and did ultrasound training, or he's doing ultrasound training now for 2 years. And my feeling is that we should have gone to him and said, listen, we'll pay for your education,
Exactly.
a return of service contract of 2 years or whatever, and get him back into this community. I don't think that Northern Health did anything to try and pull him back here. Every time when I talk about these incentives, they say, no, it's the union. It's the union.
Yeah, but
it's the
it's
union.
not.
We can't have a differential between us and other people. And I don't know if that is the truth or that is just a smoke screen that they put up the whole time.
So I've spoken to, I'm not sure if she was the head of the nurses union or the northern part of the nurses union, but they said, no, there's no such thing about giving like a northern allowance or a northern. She didn't know of any at the time anyway, but we could probably check into that and see if that's the position of the nurses union. But as far as I know, there's nothing stopping us from doing things like that, either assisting in education or providing a northern premium for nurses. I don't know of any impediment to that. Councillor Gerwing.
Thanks. Yeah, so I'll just reiterate my concern around that is that we can offer incentives, but if the work environment isn't conducive to having people stay, then they're not going to stay. And then I just wanted to point out too, that I think we all feel that we need to, I think we've done a lot of lobbying throughout the years and continue to do that. But, you know, if we were actually creating a business case to start a community diagnostic service agreement between the municipality and our local healthcare providers, the clinic, whatever we want to call it, then that also applies pressure, right? It's a huge lobbying endeavor. And it also says that we're willing to put our money where our mouth is, and we're willing to come to the table with solutions. We're not coming asking for anything, that this is what we're willing to do. But like, yeah, so like, I believe very strongly we need to continue to lobby, but I think we need to lobby with, because we've informed Mr. Dix won't meet with us. We've, you know, gone to Northern Health, we've gone to the board, we've gone to the president, like we've done all of those for years, right? Whether it was maternity, whether it was ultrasound, like whether it was transportation, like we've been through all of those avenues, right? So this might be something to consider.
Councillor Penny.
And add as well, Dr. Mostert mentioned something earlier about letting the community know, because I'll say I've been fortunate enough that I hadn't had the need for much medical care while I've been living here. So I was unaware of how horrible really our situation is. And I'm sure that there's a lot of residents in this community that have no idea, that just expect, now that we have 911 even, they think it's even better. They're gonna be able to pick up that phone and they're gonna be taken care of, but they have no idea how limited the services are here right now. So educating the whole community is something that, like I said, Northern Health should have informed everybody, besides one little post on Facebook about one thing. The whole community should be kept up to date. So I'm not sure how we go about that, but.
Councillor Souls.
I just would like to remind council that though you weren't all sitting at that table in our previous council, that Mr. Dick's word to our council was that your hospital is in Prince George. And he said it, that's a quote, your hospital is in Prince George. So I don't believe that it is only Northern Health. I think that there's at very least tactic approval for the measures that Northern Health have taken to centralize the service.
So I guess, when we talk about service levels, and I have to say that the doctors here have done a wonderful job of providing service for our community. My brother is in Salmon Arm. If he wants an appointment with the doctor and it's not an emergency, it's 2 weeks. Same for my friends in Prince George, 2 weeks to get in to see a doctor. I can usually get in to see a doctor the same day or the next day. Well, I can go up to the hospital and I can get blood drawn when there's a lab tech, sometimes even the same day. Not so with them. I've had a procedure done that my brother is waiting for now. I got it done in a month. He's been 4 months now and he hasn't got in yet. I know COVID gets in the way and I know there's other things. In some ways, we're very fortunate with the day-to-day being able to get a prescription filled in the same day, et cetera, et cetera. For these more difficult, maybe more life-threatening things, as Dr. Mostert has pointed out, for things like strokes, where we need to diagnose, or a doctor needs to diagnose this right away in order to treat the patient properly, this is where I feel we fall short. We fall short in patients in our community having to go out for maternity care. And that's a tremendous burden on young families. There's no doubt about it. And also for other things like for cancer care. We don't have a physiotherapist here. We fall short in a lot of different areas. And but I did want to point out that we are very fortunate in the physicians that we have here. We're really grateful. And sometimes we don't say that enough. Anything else for Dr. Mostert? Councillor Gerwin.
Is there anything else that you'd like to share with us? No.
As you know, that we are potentially going to lose 2 physicians in summer of next year, so June, July. It looks like we are having one candidate hopefully through in the spring PRA cohort, so that is going to be in August, September of next year, and then one candidate hopefully in the fall cohort, which is going to materialize hopefully for us in January or February of 2023. That is putting an extra strain on the local physicians, because it's going to mean not only huge pressures at the clinic, but it's also at the hospital where your on-call roster then gets shortened up. And that then puts strain, especially on the older physicians like me. But it puts strain on the whole system, because it does then make it more difficult to deliver care.
Councillor Gerwin.
So something else that we've talked about very often is like residents come with concerns or whatever, and we never know whether whether we should take action or not. Do you know what I mean? It's like, should we get involved in recruiting? Like, you know, is this, so we wanted to speak with you about like, would you appreciate a recruiting package? Would you appreciate mayor and council being involved in the recruiting process? Like, how do you see that happening, if at all?
As I said before, is that I really appreciate what you guys have done already in regards to housing and stuff like that. Because I think that we need to have some way to differentiate us from other communities. And yes, I would appreciate any help what the council can give in regards to recruitment. The trouble is at the moment that Northern Health is doing all the recruitment and they filtering through to us what they want to filter through to us. When we used to do our own recruitment, we went out and we tried to get people to come in. But in the last, I would say 10, 15 years, that has been mainly Northern Health that is doing it. And they're looking at mainly these PRA candidates, which is practice ready candidates to come into our community. And they don't look at anything in regards to retention or anything like that. And they don't look at recruitment outside of that very narrow scope. So whatever the town and council can do in regards to helping with recruitment, it would be appreciated.
Ms. McIver.
I just wanted to backfill that a little bit. So I've had a number of meetings and discussions with Daphne Savoy, who's the physician recruiter for the Northeast for Northern Health. So I've dealt with Daphne quite a few times over the last probably 6 or 7 years, but obviously with the recent resignations, she was in touch because she wanted to get active as quick as possible on recruiting. So what she was describing was that her approach has changed in recent years to recruiting physicians to the Northeast. And so she's really focusing her efforts on Canadian trained IMGs. So basically people who may have attended medical school outside of Canada, but have completed their residency in Canada. And she's approaching them and making connections while they're in their residency. So they aren't, it's kind of before they're actually looking for a job to try to start developing those relationships. And she's reported that that approach has been pretty successful in some of the other communities like Chetwynd and Tumbler Ridge. And in her mind, a lot of the other communities that were in a pretty dire need in recent years have been doctored up, for lack of a better phrase. And we were considered one of those doctored up communities until things changed. So her initial, she did say that she would look at PRA physicians for Fort Nelson, but completely acknowledging that it's very difficult to retain PRA physicians in the communities that they're placed. So you have them for their return of service, but after that, chances are they're going to go elsewhere. And that's just the nature of the beast of that program. But she has noticed that these Canadian trained IMGs are likely to stay in the communities that they choose to move to because they have a choice. They aren't tied necessarily to an obligation of the program that they've come through. Dr. Nixon was one of those physicians, and she exceeded her return of service by quite a few years. No, she's not a lifelong Fort Nelson resident, but she did give us a good chunk of time. And I think she did enjoy her time here. So, and she also said, you know, communities need to be aware of the fact that the nature of practicing medicine has changed, that people, well, and work has changed. People don't go necessarily to a place where they're going to work there for 30 years or 40 years. Thank you for doing that, Dr. Mostert. But the younger folks, I think, find themselves a bit more mobile. So just acknowledging that, you know, her pitch is these small communities are a great place to start. You know, trying to relieve that pressure of they want you and they want to have you for your entire life. So don't ever think of leaving. So, you know, I was kind of heartened by what she shared in terms of the approach that she's taking. And she's been really open about, you know, the candidates that she's talking to and and that she does have a number of folks that she's going to reach out with Fort Nelson as an opportunity. And I think that the PRA candidates that have kind of been flowed through for immediate interviews are probably the tip of the iceberg. So anyways, I don't know if you've had a chance to talk to Daphne, but I could certainly put her in touch with you and she can put me in a bit more.
I can talk to Daphne. I mean, part of the problem is that rural Canada has been served mostly with foreign trained doctors. And the colleges has made it very difficult for foreign trained doctors now to come into the country. So they cut off the supply there. And that has affected rural Canada to a great extent. I think in Saskatchewan, where I worked before, about 50 or 60% of their positions was South African trained. And the feed from South Africa has completely stopped now. The only way that you can get in now as a foreign trained doctor is either through the IMG program, where you got to redo your residency here, or through the PRA candidate, and there's only something like 20 or 30 spots twice a year in BC for the PRA candidates. So that has caused a huge pressure on the whole rural system, because there is not that many Canadian trained doctors that come to rural areas.
Not only that, but Canadian trained doctors, a lot of them go elsewhere. They go stateside for better money. And that's an issue. Councillor Gerwin.
I think it would be extremely difficult to recruit doctors to a community that is isolated and doesn't have access to pretty standard diagnostic services, i.e. ultrasound, lab services. Shall I continue? CT scanners, like, so, you know.
Already in a community like Nelson, as a family physician, you're working without the support of specialists. And now if you got to work without the support of your diagnostics, it makes it very, very difficult. And it dissuades some, especially the newer trained grads, of coming here. And the older trained grads just put their roots down and they don't want to move.
Yeah, because like who would want to do that? Like it just doesn't make sense until we get that piece. And like I said at the beginning, I feel like we're just playing whack-a-mole, because it has, you know, not that we solve any of them, but they just continue to pop up, right? So I don't know. I think maybe, I don't know how everybody else feels, but I'm pretty intrigued with the idea that I'm calling the Community Diagnostic Service Agreement. And Marius did say that he would be willing to read it if in fact, but I don't know if that's really somewhere that we can go or not.
I hope so. We'll think about it. We'll talk.
Very well. Okay, I see it's 1 o'clock and I know Dr. Mostert's got to get back to his practice. So if there's nothing else, I'll ask for a motion to adjourn. Moved by Councillor Souls, seconded by Councillor Penny. All those in favor? Carried. We are adjourned. Thank you. Thank you very much, Dr. Mostert.